This is a place where care is extraordinary.
We're not just treating, the medical, the illness, the trauma. We're really caring about the whole child.
It's so friendly to work with everyone here, and the patients, I think they see that.
Tufts listens to the patient.
When you're actually in the trenches taking care of people day in, day out, you see the quality that's delivered.
We track about 400 different measures of quality that we report to the government and state agencies. Measures like mortality rates, measures like infection rates, measures like patient experience. On each of those measures, our performance is just absolutely outstanding when compared against other hospitals, other academic medical centers across the country and locally.
The level of pharmacy practice here is amazing. We review all medication orders. We look for appropriateness in medication choice, dosing. Is it appropriate for that patient based off of whatever is going on with them at the moment, what brought them into the hospital? Everyone truly is dedicated to making sure the patients here have the best care possible.
This is a very relationship-based organization, and without the relationships that you see, we wouldn't have the quality that exists here today. It is the people of Tufts Medical Center that make it what it is.
Way on the top, from the CEO of the hospital and down to the people that just take care, the housekeeping. It's everybody that works in the hospital, and even their roles are a little bit different, but they all play important parts for the patient care.
In the morning, I do the trash, the linen, sweep the floor, make sure everything is nice and clean. If they need something else, I just ask anything I can do for you. Whatever they need, I just try to do my best so they can feel better.
We've had patients who travel from South America, from Argentina, and we've had patients even come from Canada, which is like a 5-hour drive from Montreal, and they'll just come here because they don't have studies or any treatments available there. We have worldwide known physicians that people, patients are seeking them out, and they're traveling here just to see them.
When we sit down to round, we talk about the medical illness that the patient has, and a lot of good quality care involves taking that discussion in the right direction and being able to ask the right questions. And the fact that at Tufts the environment is so collegial, it makes the discussion a lot easier. And it makes the conversation go from just discussing the common diseases to some of the rare diseases and some questions that one might not ask in an environment that's not as positive and patient-centered as it is at Tufts.
You need to have everyone focused on delivering quality care every day and everything they do, whether it's something that they know is measured or something that is impossible to measure. You can focus on urinary tract infections and eliminating that, and that's because that's easy to measure. But there's so many things that are hard to measure, like choosing the proper patient to actually have an operation, doing surgery that's only needed and necessary. You really need everyone committed to that every day, rather than just a few small things that we can get a number for.
We just really need to be innovators and really look deep. And that is really what Tufts is about. How do we make this better? Why? Why is it important? Because it's for patients, for families. It's really driving care from the bedside and furthering it out nationwide.
Every day we're doing work to improve care through drug development, through device development, through procedure development, and really working to find new and better ways to treat diseases in subjects for improved outcomes.
Quality care isn't just providing care in the hospital, but it's helping people to focus on smoking cessation, diabetes prevention, chronic disease management, so that they can fulfill their lives, they can go to school, they can work, they can be happy with their families. So we provide health education, health screenings, and different ways to help people stay healthy.
No matter what, a hospitalization can be a scary experience for a child and their family. It's really rewarding to when you first meet a child and they're not really feeling well, they're sleeping a lot, they're in bed, and then you get to spend time with them and work with them over the course of a few days or the week, and then really by the end of their hospitalization, they're up and moving and playing and smiling and actually saying they don't want to go home. That's when you know you did something right.